Dr. Anthony Guerrerio and Dr. Pamela Guerrerio have been wonderful assets to this community. Dr. Guerrerio has taken on the question of GI. A lot of us earlier on were trying to get answers to GI, and there weren't too many families. Now we realize that a lot of our families do have GI issues, and it's one of those issues that are with us on a day-to-day. So Dr. Guerrerio has been fantastic in that respect and still has a lot of questions to answer. He's going to be really busy, along with Dr. Pamela Guerrerio, who's been helping us on the allergy part. So please welcome them.
Thank you so much. Good morning. I'm Pam Guerrerio. I am one of the pediatric allergists at Hopkins, and we've been studying the immunologic changes that seem to be associated with Loeys-Dietz syndrome. The work that I'm going to tell you about this morning has been very much of a collaborative effort, and one of the key people that has been working with me is Dr. Tony Guerrerio, who, as mentioned, is a pediatric gastroenterologist. So we're going to tag team this morning and tell you about what we found so far. So as more and more people were diagnosed with Loeys-Dietz after it was originally described in 2005, it started to become very clear that there seemed to be other symptoms associated with the disease that weren't necessarily recognized initially. And it turned out that many of these symptoms seemed to fall into the category of allergies as well as GI, gastrointestinal complaints. Because of that, we started working with Dr. Dietz and other members of the Loeys-Dietz team to try and really define exactly which of these symptoms are truly associated with Loeys-Dietz syndrome and which of them are unrelated. We had a lot of reasons to suspect that TGF-beta might be associated with allergic disease. There's been a number of studies showing that infants that are breastfed tend to have a lower risk of allergic disease, and the reason for that is thought to be the presence of TGF-beta in breast milk, which is at much higher levels than what you would find in formula. There's been other studies showing that white blood cells in the lining of the intestines of kids with food allergy tend to produce less TGF-beta than their non-allergic counterparts. And finally, it's known that certain genetic changes in the TGF-beta gene itself can actually predict how severe a person's asthma is. We also suspected that there may be some GI disease associated with this syndrome. There's been lots and lots of different types of mice that have been created in the lab that have various alterations in the TGF-beta signaling pathway. And just about every one of those kinds of mice have some sort of gastrointestinal inflammation. So we sort of suspected that Loeys-Dietz, because of the mutation in the receptor for TGF-beta, would also have perhaps some GI issues as well. So to begin to answer some of these questions, we undertook a clinical study where we mailed a questionnaire to all people that had been diagnosed with Loeys-Dietz, who had been seen by Dr. Dietz through the end of 2008. And we were so happy because 85% of you responded. And we want to say, first of all, a big, huge thank you to all of you who did. Another 60% of you were actually able to also give us a blood sample, and what that enabled us to do is to do some laboratory studies to help really correlate with what we were finding in the questionnaire. So for those of you who filled out our very long survey, you'll know that we asked you about all different types of allergic disease. We also asked about lots of different types of GI symptoms that you or your child may have experienced. And the goal of this was really to understand, were there any problems associated with the immune system and Loeys-Dietz syndrome? What we found in a nutshell is that Loeys-Dietz syndrome seems to be associated with a tremendously increased risk of virtually all the different varieties of allergic disease. We found that almost half of the people who answered our questionnaire with Loeys-Dietz reported seasonal allergies, and that's compared to only about 10 to 15% in the general population, so very significantly increased. And some people just experienced allergies during the spring pollen season, but many people also experience symptoms year-round if they're allergic to cat or dog or dust mite or something that's present all the time. We found that just under 50%, about 45% of Loeys-Dietz people had asthma. And many of these people continue to require asthma medications at the time of the questionnaire. Again, this is much higher frequency than what we see in the general population, where only about 7% of people are diagnosed with asthma. One of the benefits of us, studying Loeys-Dietz as a group is that we begin to see some patterns. And I think one of the most helpful things we've seen with regard to asthma and Loeys-Dietz syndrome is that many times the asthma seems to be driven by chronic sinus disease. And we think this sinus disease is not so much because of a defect in the immune system of people with Loeys-Dietz. It seems to be more driven by the difference in the structure of the sinus passages because of the anatomy or the structure of the skull. But more importantly, what we found is that if we aggressively treat this sinus disease, the asthma almost tremendously improves. And what that means is less steroid for those kids or those adults with asthma and less missed days of school. And by aggressive treatment, this may involve, several weeks and, for some people, months of antibiotics, which a lot of people are very reticent to do. But the benefit that you get from keeping the asthma under good control and keeping, these kids and these people out of the hospital is worth the extra medication. Eczema is a skin condition. It's a real red, itchy, scaly rash that is usually caused by allergies. We found that about 40% of people with Loeys-Dietz syndrome have eczema. Again, very tremendously increased over what you would see in a general population, where at most 15% of people have eczema. So all these different varieties of allergic disease seem to be very much increased in people with Loeys-Dietz syndrome. Finally, we also looked at food allergy, and food allergy is a very tricky diagnosis because you have to distinguish what is a true food allergy from other sorts of reactions to food, including food intolerances and other adverse reactions. To truly have a food allergy, you have to have an immunologic response to a food protein, and protein is the key here. Most intolerances to foods are actually a reaction to the carbohydrates or the sugars on the food. And an example here would be lactose intolerant. People think that they're allergic to milk because they can't drink it, they get GI symptoms. But in some cases that's lactose intolerance, and in other cases it's actually a true allergy to milk. A second feature of true food allergy is that extremely small amounts of the food can cause a reaction, in some cases very severe reactions. And when we say severe, some of those reactions can even be fatal. The prevalence of food allergy in the general population in adults is about 3 to 4%. It can be as high as 6% in kids in the general population. But in Loeys-Dietz, when we use that very stringent definition of food allergy that I just mentioned, we're finding that about 22% of people with Loeys-Dietz have true food allergy. We think that this is probably an underestimate because when we use a more loose definition of food allergy where, we asked people, did you ever have a reaction to a food and had symptoms that we believe to represent a true food allergy, it turns out that almost 40% of Loeys-Dietz people reported a positive to that question. So we definitely believe that this is a very prevalent problem among Loeys-Dietz people. Most people with Loeys-Dietz tend to be allergic to multiple foods, although you can be allergic to just one or two. As I mentioned, it's tricky. Food allergy is tricky because we don't have great tests for it. And interpreting the tests from food allergy can be very confusing. And some allergists, want to give too much importance to a number or to a skin test. And so the point that I want to emphasize here is that you can't make decisions about what foods a child should be avoiding simply on the basis of a test. There's a lot of other things that you need to take into that to consider. And it can be actually dangerous to take a food out of a diet when they're not actually allergic to that food, even though they have a positive test. The second point I want to emphasize is that reactions to foods that you are allergic to can be severe. And the only treatment we have for food allergy right now is treating a reaction when it occurs. And we do that using an EpiPen. So I encourage all patients with food allergy, regardless if you have Loeys-Dietz syndrome or not, to have an EpiPen with them at all times, whether it be at school or at the daycare. That being said, we are a little bit more reticent about using an EpiPen in a child or an individual with Loeys-Dietz syndrome. And the reason is because of the heart and the other vascular differences that occur in people with Loeys-Dietz syndrome. What epinephrine does, the EpiPen does, is it increases your heart rate. And that may be a side effect that we don't necessarily want to have in people with Loeys-Dietz. The reason I mention this is that some school policies are to give an EpiPen to a child if they've even been exposed, even if they're not having symptoms, but if they've simply been exposed to a food that they're allergic to go ahead and give the EpiPen. And we wouldn't necessarily recommend that. In those kids with Loeys-Dietz, we would suggest that they be treated first, evaluated first, maybe given an antihistamine, and only use the EpiPen if it's a very life-threatening reaction. So we're always happy to talk to schools and child care providers about that and the importance of using the EpiPen if it's necessary, but not using it if other treatments have been effective. In the general population, kids are most commonly allergic to milk, egg, peanut, soy, wheat, and nuts. And this seems to be true in people with Loeys-Dietz syndrome as well. In older kids and adults, the food allergies tend to be more the nuts and the seafood. You might ask, what are the symptoms of food allergy? They can really be quite variable. Some people primarily have skin changes, so they may have hives or eczema. Others have more GI or respiratory symptoms, so certainly vomiting and diarrhea or even just poor growth alone can be a sign that you have a food allergy that's affecting primarily your GI tract. You might hear more about asthma or wheezing being a common symptom of a food allergy. And then finally, in very severe cases, people can develop low blood pressure or even shock. And those, as you might expect, are true indications for using an EpiPen and represent true anaphylaxis. Okay. So with that, I'm going to turn things over to Dr. Tony Guerrerio. I'll be happy to answer any questions after he's had a chance to finish his story about the GI manifestations of Loeys-Dietz.